The risk of cancer was over 3% for patients with fatigue and particular vague symptoms like weight loss and abdominal pain if they were over a certain age.
For children presenting with uncomplicated chest infections, but actually it's not the clinical picture of pneumonia, those children are very unlikely to benefit from antibiotics.
In a quarter of cases, the tests were either partially or fully unnecessary.
GPs respond to financial incentives, so we're not saying it's not important, we're just saying other motivational factors may also be quite important.
There's a clear association risk of overprescribing of both antibiotics and opioids with GPs practices that have high levels of burnout.
For well-being, we found a general positive effect, and also for anxiety and depression.
Symptoms of perimenopause and menopause were often not being recognised because they were described differently in words and ways that to the clinician didn't correspond with their knowledge.
Final recent GP contact was associated with men who presented with a mental health problem and also had recent self-harm and had recent work-related problems.
1 in 4 older people experienced at least one adverse drug reaction over the 6-year period. In particular, patients prescribed 10 or more medicines had a 3-fold increased risk of experiencing an adverse drug reaction.